Good morning. Thank you so much for joining us this morning. Today, we have a very special guest with us, Agnes from Hungary. We will be interviewing her on Callanetics exercise and also how she's been working with women to transform their bodies.
Thank you. Hello.
Hello, Agnes. Would you like to tell us about yourself and how you have been helping women?
Yes, thank you so much for this opportunity, first of all. I really appreciate it. So thank you. So my name is Agnes. I'm Hungarian. And just a little bit about myself. At the moment, I move between Hungary and Germany, Berlin. But I used to live in Berlin for 6 years. And before that, I used to live in England for 14 years. And so right now I'm moving between the two places, which I can do because I work online now. And so I have become a Callanetics exercise method teacher in 2007. That was 15 years ago. And what my passion is to help women who are committed to transform their bodies. And when I say transform their bodies, I mean it can be body shape, strength, flexibility, and also pain, and specifically back pain and pelvic and abdominal pain. So in the last few years, I started to focus specifically on women who suffer from endometriosis. And it is because these wonderful magical exercises actually make even the most severe cases symptom-free within a few months. I will talk a little bit more about that later. So that's my passion, to help women to transform their bodies.
Wow, that's such a beautiful thing that you just described there. So what is your story and how did you decide to start this?
So my story with endometriosis is quite different. And it is because I actually have never been diagnosed with endometriosis. And there is a reason for that. Basically, first of all, it takes an average 7 years for women to get a diagnosis. But I had a very typical case. I started to suffer from pain when I started my periods, and it was quite severe. I ended up in hospital as well to get injection pain relief. And I didn't know that it was not normal. And so what the usual case is that we go to the gynecologist, and unfortunately, we can't get much help at this moment in time. And so I was also told that I wasn't told that it is normal, but I wasn't told that it is not normal. And so I was told to go on to contraception pills, and that will take the pain away. So I did that, and my pain went away. And then years and years and years later, I came off the pills when the pain came back. Now, it was nothing to do with that I actually changed career and started to teach the Callanetics exercises. It was because I loved those exercises, and there are so little amount of teachers around the world that when I moved to England, there was no teacher that I could go to. So I decided to become a teacher myself. What I was experiencing regarding the pain before that, and that was a little motivation to be my own boss, is that I was terrified of losing my jobs whenever I was working, because it is very normal for women who suffer from this kind of pain that we cannot simply get out of bed when our period starts. And for many women, it's not just reduced to the time of the menstruation, but throughout the whole month. So I was a luckier one who only experienced the pain before my menstruation. So, and you know, it's a terror, it's a horror to call in again and again and again and call sick and be terrified of when am I going to lose your job? When is my boss going to stop believing me that I really can't get out of bed and I can't go into work? So anyway, I changed my career. I started to be my own boss. I started to teach these exercises, and miraculously, my pain was gone. And I always knew that Callanetics helped period pains. What I still didn't know at that point, that there was such a thing as endometriosis, and my pain was already gone. And so I found out about endometriosis when my first client with endometriosis, that was more than 10 years ago now, she comes to one of our sessions and she says to me, Agnes, I don't have to have operation for my endometriosis. And I'm like, what is endometriosis? And then she told me about how she has been suffering, that she has been having operations every few years, and she was scheduled to her next one, and she went for the checkup prior to her operation to her gynecologist. But because she told her gynecologist that her pain was basically gone, she didn't have to have the operation, and that was more than 10 years ago, and she never needed another operation since. So that's when I found out about what endometriosis was, but I still wasn't focusing on helping women with endometriosis. I still didn't know what impact it had and on how many women. So later on, as I was expanding my business and as I was growing myself, you know, we always change what we teach as we grow and adopt. And so then I came across endometriosis again in my life just a few years ago. And I did some research. I spoke with women. I put out surveys. And that's when I really got present to that something has to be done about this in this world. It's unacceptable, simply, that so many women suffer and so badly. Their lives are impacted so badly. Their lives are taken away from them because of this disease. And that's when I decided that I am going to make this my mission, not only to help women who suffer from this pain, but going beyond that. What I actually want in this world is a paradigm shift. And my vision is that women are healing themselves with the support of the medical system, which is unfortunately not what is right now. But that's my mission, that's my vision, and I'm never going to give that up.
Oh, wow. That is such a brilliant thing that you're doing for women out there that have endometriosis. I think it's something that all women need to do, or exercises women need to do. I'm sure these exercises are things that can be done from home, or things that can be done in the comfort of our homes. So what exactly is the Callanetics exercise? How does this work? What
Okay,
method is used?
Great. It's a very, very unique exercise program. It's been out since 1986. The lady who invented these exercises is called Callanetics, my hero. And she made this exercise program extremely popular in the entire world. And but it was such a long time ago that it became a little bit forgotten. And then it made a comeback a while ago. But really, I feel that so many more people need to know about that it exists, because still at the moment, most people now wouldn't know. Women who used to do this exercise program in the 80s, they all remember that they never did something that was more effective than that. But they also all say that they don't know who teaches it anymore, but you actually can find teachers still. And I teach now online. So really I'm available for the entire world. But getting back to what these exercises are, it's a no impact exercise program. So it puts no impact on the cardiovascular system and the joints. It's extremely adaptable. So literally everybody can do this exercise program. It consists of small repetitive motions mainly, but also other types of motions as well, but that's the most general motion in Callanetics, tiny repetitive motions that really go very deep into the muscles. It's a deep muscle toning exercise program. Some of the Callanetics concepts are body alignment. It is based on correct body alignment, and it corrects body alignment as well. Another concept is relaxation. We actually work in a relaxed manner, and we even relax the muscles that we work on. It's very, very gentle. We use the pelvic floor muscles, which is a very, very strong and main part of this exercise method. And there are several more concepts that really would be worth talking more about if we actually were exercising. So you could also try it out. So this way it would be just a lot of information if I talked more about the actual concepts. But I think you get the idea. It's a soft, gentle, very feminine exercise program. Now, don't get me wrong, it is challenging, but the reason why it's still suitable for every woman, because it's gentle and for everybody, and everybody can work at their own pace and at their own fitness level. So people who come to class, doesn't matter how fit they are, doesn't matter how old they are, doesn't matter what fitness level they are at. Everybody can even be in the same class. Now, I know that women who suffer from endometriosis can have the kind of pain that immobilize them as well. So I actually, even though it is for everybody and very adaptable, I still run classes, pelvic rehab classes. I call them pelvic rehab classes, which includes Callanetics and some other methods as well, which I developed specifically for women who are in a lot of pain. So that even could be done in bed. Some of it could even be done in the mind first. So I made that possible as well. But in general, it's super adaptable. It is inspired by ballet and yoga. However, no one has to be able to do ballet and yoga to be able to do these exercises.
Wow,
And
so where...
Yeah, sorry, just one more thing I wanted to add, which is very important because of the chronic pain. It detoxicates the entire body, all of the muscles, because these tiny, tiny repetitive motions that we call pulsing, I'm showing this because it's really that big, and some of the motions that we do, it's called pulsing. And this pulsing pumps blood into the muscles, practically washes everything out. And this is the way how it can detoxicate the body. The toxins come out of the muscles, back into the blood flow, and then the liver can do its job. So detoxicates the entire pelvis, the entire abdominal area, starting from the deepest layers coming outwards. And detoxicating is one effect, strengthening, teaching all the muscles how to work by design. So there was a version of Callanetics that came out in the past, which was called body by design. And I love this term because really it teaches your muscles to work the way they were designed to work. So the body just gets restored, basically.
Wow, this is so interesting. Like listening to this, I feel like I really need to be in one of these classes. So where exactly do you do the classes? Do we have to book on Zoom, or you have an app?
Yes, I work on Zoom, and thank you for your interest. Of course, I would love to have you in my classes. And luckily, because I teach online, the distance is not a problem. So everyone can do this in her home, exactly the way we are on Zoom right now. Imagine that you and I, now we are on an exercise mat and we both exercise. And maybe you can come as a private client where it's just one-to-one, but it's the same in a group setting. But imagine that I am here, and then on the other side, you are with a few more ladies. Mm-hmm. And so everybody in their living room, exactly like right now, just on our mats, I give the instructions, you follow me, I see you, I correct you, I call you by name, and I make sure, Glory, lift your arm, push your leg back, come, and I correct you. I have eagle eyes, I see everything. People always compliment me, how did you see this? Well, I see everything. I've been teaching this for so long. Sometimes I'm just seeing one body part, I could tell what to correct. I wouldn't even need to see the whole body always. So that's how it works on Zoom, and it's live and interactive. However, if somebody has to miss a class, I can always send a recording, so the person could always make up for a missed session. And I also have video programs for those. So for example, I live in Europe, and if you really live in the opposite end of the world, then maybe the times are not suitable for you. But for those people, we could take private sessions, one-on-one. With most of the people in the world, I can't find the time for private sessions. even though even if the class times don't suit those people. And I also have video programs available.
And so the video programs, are they on CD or DVD that we can
They are
purchase?
online. They are
Oh,
online.
okay.
The video portal I have online, that people log on and then they can choose the video program they want to do during the day. Okay. Whichever, there's a few. And this video program also includes my live class recordings, which are always different. So if you always want something new and never do the same videos again, you just work on those.
Definitely. Thank you so much, Agnes, for coming and joining us this morning. It's been really interesting to see. I think we're probably going to bring you back again to the live session with us, and me being on the mat. So I definitely would need to get myself a mat so that I can do the recording, and hopefully we'll be able to share it with our clients so they can see the exercises. Because the reason why I really like this exercise is because it helps women, because my passion is to help women, and I really want women to be their better self and to be a much happier and confident woman. So thank you so much once again, Agnes, for joining us this morning, and we will see you again soon. Have a lovely day.
Thank you
just
so
before
much.
we go, we are obviously going to show a video testimonial of Agnes and her clients.
I started doing Agnes's exercises about 6 months ago, and the difference, it's not an exaggeration to say it's been life-changing. I was in a very bad place last summer. I've had endometriosis for years and years, decades, but by last summer, the pain that I was experiencing virtually all the way through the month had become so debilitating. There was only really about 1 or 2 days during a month cycle when I wasn't in a lot of pain. I was completely dependent on my TENS machine to function and in a very low place. Well, 6 months on, my periods are still pretty horrible, but throughout the rest of the month, whereas I was only having 1 or 2 days without pain, now I'm only having 1 or 2 days with pain. And I haven't used my TENS machine for several months because I haven't needed to. My periods have decreased in duration from about 11 to 12 days of bleeding to now around about 5 or 6. And the length of time that I'm in severe pain is so much reduced. And they are so much better. And it's changed the way I'm feeling about my own body, which is something that I have grumbled about and had a bad relationship with for a long time, when I know I should have gratitude for the way that my body does function and do the things that I need it to do. And I am grateful to God for my body now. And it's Callanetics appeals to the kind of musician in me, because all of a sudden I'm seeing my body is like an instrument that I can kind of train and I can gain mastery of this thing. When I look to the future now, I feel so positive and hopeful. I feel so much stronger, supple, and yeah, the big thing really is the reduction in pain. It's just fantastic. Doing the classes with Agnes is so fantastic because she's a tonic. She's like having a great big dollop of sunshine and joy beamed into your life, into your morning. And she's compassionate, she's so positive, she's completely approachable and very understanding. Callanetics is brilliant, and I can't imagine a better teacher than Agnes. So, and for anybody with any endometriosis or any pelvic health symptoms, problems, I would wholeheartedly recommend it.